about your health? Do you know about your body? Do you know what to do and how to do it health-wise? Can you live a healthy life? Can we have healthy children? This is not a luxury, you've got to know health-wise. This is health-wise. This is health-wise. This is health-wise.
Hello Lagos, hello Nigeria. This is your one-stop informative, educative and entertaining health show, Healthwise. I am Adeshegun Temitope. On today's episode, we'll be discussing first aid. Don't touch that dial, we'll be right back. Thank you. Welcome back. I have here with me the MD of Adon Health Services Limited, Dr. Dare Tanko. Thank you for coming.
Thank you for having me.
And also with me on set is Mr. Akinfosile, Dare Joseph. He's a Divisional Training Advisor, Nigerian Red Cross Society, Lagos State Branch, Mainland Division, and also an affiliate member of World Safety Organization. Thank you for coming, Mr. Dare. Thank you so much.
Thank you.
Now, let's define first aid, Dr. Dare.
Well, first aid is the assistance that you give to somebody with a sudden illness or sudden injury.
Okay.
And then there are three aspects of it. The first one is that you try to prevent the person from dying if you can.
Sure.
Then also you try to prevent further harm from coming to that person.
Okay.
And then you try to promote healing.
Okay.
All at the same time. So those are the three P's of the
First
aims of
first
aid.
Now, let's talk about, briefly now, the history of first aid.
Well, first aid is not a recent phenomenon.
Okay.
It's been in existence as long as we can remember. For those of us who are familiar with the story of the Good Samaritan, it's as dated as that. So first aid has been in existence for a while. However, the efforts of Sir Jenner Donald, who is the founder of the Red Cross,
Okay.
actually brought to light the humanitarian aspect of actually giving first aid in emergencies, during war, and what have you.
Okay, thank you very much. Now, why is first aid important, doctor?
Well, first aid is very important because most illnesses and injuries don't occur in a medical setting or in a hospital setting. They're usually maybe at home, at work, on the road, or, you know. So it's important for people that are around to have at least the basic knowledge of what they can do to safeguard that life or prevent further injury to that person. That's why it's quite
Now,
important.
let's look at the importance of first aid kits. What do you have to say, Mr. Dare?
Well, it's quite important for you to have a first aid kit.
Okay.
Most importantly is the first aid knowledge. You should
Just
have your
key.
kits, but then the most important one should be the first aid knowledge.
You want to take us through that? How to use it?
Well, there are various components of the first aid kits, and depending on the situations, most first aid kits are designed to take care of minor injuries.
Okay.
So when you are on the highway, for instance, and there is a severe road traffic crash where there's a possibly loss of limbs, protruding abdominal content, sometimes your first aid kit might not be
Effective.
sufficient. But
Okay.
most first aid kits basically are designed for minor injuries. But at minimum, you should have your gloves in your first aid kit, at minimum.
Okay.
And then triangular bandages and other forms of bandages.
Antiseptics, sterilizer,
Okay.
Because you may need to, of course, clean your hands before you wear your gloves and touch the wounded person.
Okay.
And then you have sterilized bandages, you need adhesives, you need crepe bandages that you can use for sprains or to bind some splinters if you want to maybe hold a fracture or something. So there are a few things you can have for the home.
Okay.
There are certain things that you may need. You need a pair of scissors, you need tweezers, you need, like we talked, bandages, you need plaster, you know, you need some form of antiseptic, you know, to use on the wound. So those are some of the basic things, cotton wool, spirit, you know.
So can anyone administer first aid?
Anyone and everyone should be able to administer first aid.
Okay.
Like I said, it doesn't have to be with severe injuries or somebody collapsing.
Okay.
You have common occurrences like diarrhea and vomiting, allergies, insect bites, sprains, choking, just minor things that happen around the house, scald injury from hot substances. So somebody should at least have some knowledge of what to do before you take the person to the hospital, if it's necessary, how to assess whether an injury is severe enough to require hospital management, or it's something you could just manage there and then, and the person will be all right.
So, Mr. Akin, how can one receive first aid training?
There are a number of organizations that provide first aid training.
Okay.
The Red Cross, Nigerian Red Cross Society, provides first aid training.
That's good.
A World Safety Organization provides first aid training. And private training firms actually provide first aid training. But what you should look out for is the quality of the first aid training being provided.
Thank you so much, Mr. Akin. Now, we'll go on a short break and we stay here on Healthwise. We've been discussing first aid. Relax, don't touch that dial. We'll be back. Welcome back. Dr. Dare, what is the proper procedure for first aid?
Well, the proper procedure for first aid is that the first instance, maybe you, depending on what you see, but the first instance you call the person just to be sure that the person is conscious. If the person can answer, at times somebody is conscious but is not well oriented. So somebody is conscious and then you look around so that you can prevent further harm. For instance, if it was a case of electric shock, you will not want to rush in and grab the person because the helper also could become a victim. So you look around, make sure the place is safe, and then you can now proceed on certain things depending on the situation at hand. But the first thing, make sure the person is conscious, make sure that there are no harmful objects around. For instance, if somebody fell down with an epileptic fit, the first thing is to clear, not to grab and hold the person, clear the surrounding so that in the event of movements, the person doesn't injure themselves further. So those are the two very important things to do first.
Thank you very much. Now let's talk about the basic skills and knowledge in one acquiring first aid training.
There are three aspects of first aid. Educational, prevention, and intervention. So in a first aid class, generally you get the skills of helping people. That is, you are prepared for intervention. But however, you are also taught on how to prevent certain conditions and injuries. So she had mentioned electrocution. Now, the trainees would also would like to know, how can we prevent electrocution? What are the risks of coming in contact with electricity? You've heard the rumor of, if I hold my breath and I hold on to a live wire, I won't be electrocuted. That is not true. That is definitely not true. So in first aid class, you are also taught accident prevention. Take the footbridge rather than cross the highway. Basic things like that. Wear your helmet when you're on a bike, fasten your seatbelt, and then the intervention comes in. If someone is convulsing, like she mentioned, this is what you do. If someone is bleeding, ensure you stop bleeding, bandage, and elevate the affected part. So basically, you get the knowledge of accident prevention and the intervention itself during emergency.
Now, in a broader scope, let's talk about the benefits of acquiring this knowledge and the skills.
Yes, it gives you the confidence to help.
Okay.
There is the fact that in medical emergencies, especially that has to do with respiratory and cardiac emergencies, you are likely to assist someone at home. So the person could actually be a family member, could be a friend, maybe you're on a picnic and then there is a drowning at the beach. So if the person has been rescued, you are likely to be the one around to help. So it gives you that confidence. It also builds your appreciation for accident prevention.
Thank you very much. Yeah.
And furthermore, most things that people die from, if the people around them had sufficient knowledge, such deaths could have been prevented. And one more thing I want to say is that people that have chronic illnesses, like asthma and allergies in particular, they should let their doctors write out a plan of action for them. They should laminate it and keep it in their purse, on their person, anytime they go out. So that if peradventure, like somebody has an asthma attack, of course, you can't breathe, you can't talk. If the plan of action is there, it can be retrieved and somebody can assist rather than everybody looking so helpless. Because generally, in any emergency, people want to help, but what do they do?
So now let's look at conditions that are actually rampant, that need some first aid treatment.
Well, you have events in the home.
Okay.
Can we domestic accidents? Okay. You know, for instance, cold injuries, hot water pours on somebody. All right. Well, if it's a child, we always, well, generally for anybody, put the place under running water or immerse, if it's possible, inside a bucket of water, but not ice water.
Okay.
Not ice water, just running water until the pain subsides. All right? Then, usually there is no blister. Some people want to put Vaseline on top of it. Some, I would advise maybe you put gentian violet, because gentian violet will both kill the germs as well as dry the place up. But if there are blisters, or if there is a blister, if it's not a huge one, well, you could just sterilize. Of course, you wash your hands. If you want to puncture a blister from a scald injury or from maybe somebody wore tight shoes and has some blisters as a result of that, all right? Then you wash your hands very well. You take a sharp needle, clean the tip with spirit, methylated spirit, and then you puncture the base of that blister and allow the water to run off. Don't remove the skin. The skin acts both as a protection, well, mainly as a protection from infection, because if you remove the skin, now you've exposed the underlying skin to infection. So you leave that, and then you can now apply your cold compress to it, and then also you can apply the gentian violet if you have it. So those are some of the few little things you can do at home.
Thank you very much. Mr. Akinfosile, you want to add to that?
Well, she has broadened the scope a little. Because she's a doctor, and you will understand that. But in first aid, it is lame persons are not advised to actually break blisters. But she's a doctor, she has given us that. But as a lame person, I would be concerned about reducing the residual heat and protecting it from infection. That is, the skin from infection.
Now, let's talk about the risks associated with first aid.
Wow, quite a number.
I know.
Quite a number. First is the scene. You want to help someone on the highway. You have vehicles coming, crossing, moving at certain speeds. You have to put that into consideration. Do you want to help in the bedroom? Slippery floor, slippery beds. You want to help in a construction site. You have debris. So there is the risk of injuries to the helper. That is what you should put at the back of your mind. When you approach to save or to help out, your own safety first.
It's key.
Regardless of the situation, you have to put your own safety first.
Okay.
So when you are safe, definitely you should be able to help someone.
Okay. Now, can kids help to give first aid?
Definitely.
How?
That's an interesting question. It is not just about the hands-on. It is not about the bandaging only. At minimum, kids should be able to dial emergency numbers.
That's a good one.
Do we know the emergency number of your state? If you have moved from one state to another state, or you've moved from one country to another country, do you know the emergency number? So kids should be able to know emergency numbers, address of common places they have been to, possibly the description.
Okay.
And to a certain extent, recognize the condition and be able to tell emergency service that this is the condition or this is what I can observe. Going into hands-on first aid, there are certain areas we'll show kids.
Okay.
And there are certain areas we don't bother showing them.
Oh, thank you very much. Thank you so much. A round of applause for my speakers. Now, Dr. Dari Tanko, let's have your final word.
To wrap it up, what we'll say that everybody wants to help in an emergency, but it's always good to have a knowledge. The first thing is that don't panic. And then I quickly want to slip something in also. There is what is called mental health first aid, because that also is very important for us to recognize the initial symptoms, perhaps, of somebody around us and the proper thing to do to help that person.
Okay, thank you very much. Thank you so much. Now, Mr. Akinfosile, your final word.
Okay. First aid is a state of mind. First aid is an attitude. First aid seeks to prevent accidents. First aid seeks to intervene during health emergencies. Kids can help. I started first aid when I was in GSS1, so 18 years ago. And I've been able to assist quite a number of people. And there's that satisfaction. And remember, the person you might be helping could be your relative.
That's true.
And put that
And you
back
don't
up.
have to be a doctor or a nurse to do first aid.
Yeah,
You just have to be willing
engineering.
and knowledgeable.
That's interesting. Thank you so much. Thank you very much. A round of applause for my speakers. Thank you so much, my esteemed speakers. We've learned so much today on Healthwise. I feel so honored to have you. And to my viewers at home, I'm sure you've been learning a whole lot. Don't touch that dial. We'll be right back. Thank you.